would say try to have sex as much as you can, and try not to stress yourself. And for those who really don't have the chance to meet each other that frequently, of course, then you have to come to a stage that, like you said, to try to do a ovulation kit.
Right, so you actually brought up a very good point, which I never thought of. You don't have to track your ovulation if you can.
If you're trying to conceive, and ideally, after your period, of course, that your period it's 7 days. After that, you should continue, and until, of course, that you suspect that you have ovulation and all that. Try to have sex until, don't make the eggs wait for the sperm, in other words. So the sperm should come in, because sperm actually usually lasts up to a week, but egg will die off within 24 hours. Usually that's the thing, yeah.
Right, so to maximize your chances, always have like sperm ready.
Yes, exactly. Generally, if you feel that it's not enough of a lubrication and that matters, I think avoiding all this.
So you should avoid.
You should avoid, yeah. So there's some data shows that it can affect the motility of the sperm. Yeah.
Is there a best or optimal sexual position to increase conception?
Okay, the answer is no. Of course, you can try whichever the way that you feel comfortable with. And then, the question will come to why is it so? Because that you say the sperm would swim, is it,
gravity lah.
Yeah, the gravity. So actually, as I said, the sperm swim, all right? There's no position to say that even there's a woman is in an upright position and all that. It should happen even, yeah.
Why you awkward? So I guess what doctor is trying to say is that the best position is the position of the most pleasure that makes you want to do it again tomorrow. From my friends as well, I think many of them are holding off starting a family or getting pregnant during the pandemic because they are worried that it's hard to get an appointment or it's dangerous. Do we need to be worried?
Yeah, so first thing, I like to dispel that myth. Definitely not difficult to get an appointment to see us if you are pregnant, which is great.
Fantastic.
It's also safe to fall pregnant during the COVID situation. I guess in Singapore, things are very well controlled. Local transmission has been very low. There has been no fatality in terms of pregnant women catching COVID and dying from it. So that's very reassuring for people who are trying to fall pregnant out there. Yeah, so you should definitely not delay pregnancy. For healthy pregnant women, COVID hasn't increased the risk of things like miscarriage, early labor, even fetal anomalies, so meaning problems in terms of the development of organs in the baby. So that is all very, very reassuring.
Right. Yeah. And on that note, is it safe to visit hospitals throughout this time? I'm sure it is, your doctor, pointed question. But what are the precautions the hospital is taking during this time for families?
So there's a saying that says the most dangerous place is actually the safest place, right? So hospitals are really very safe at the moment because we take pride in terms of cleanliness. The staff are obviously well equipped and trained with personal protective equipment. Of course, when people come in nowadays to see doctors, they have to go through the safe entry, temperature checking, as well as the online declaration form. So that actually is very important in terms of ensuring that everyone is safe in hospital. Patients that are high risk, so patients that are high risk of getting things like COVID, let's say we have a patient presenting with fever, cough, runny nose, or any of the symptoms that's concerning for COVID will be isolated immediately. So they are seen by specific doctors in full protective personal equipment. If they were to be warded, they would be transferred to the ward very carefully to avoid any contact with any other healthcare professionals or any other patients or visitors. And they would then be warded in the isolation ward in a single room and not allowed to have visitors until they are proven COVID negative. Right. So actually we have very, very tight work processes to ensure that the public is actually very safe from catching COVID.
Probably safer.
Yeah, in fact, I don't think that anyone has actually contracted COVID in KK. Any pregnant women contracted COVID, touch wood. The processes are really watertight there.
Right.
Yeah.
And on that note of visitors, right, you mentioned if my wife deliver during this period, can I have visitors?
Visitors? At the moment it's one visitor per patient.
which normally is what?
That you can have, we don't normally advise that many visitors anyway.
Yeah.
But there are 5, I mean in KK the protocol is such, you can actually have 5 designated visitors, but only 1 visitor at every one time. Of course, going to high-risk areas like the special care nursery or to the labor ward or NICU, I mean, it's a baby ICU unit, it's only 1 visitor. Right. So, I mean, we're still looking after the safety of our patients in that way.
What should we take when visiting the hospital? I mean, on our end.
So, I mean, I would say the general advice, so social distancing, wear your mask, hand hygiene regularly. The other thing is So, of course, we normally, like I said, we only advise 1 visitor per patient. So it'll normally be the patient and the husband coming for antenatal visit or seeing the doctor for their pregnancy. So try to avoid bringing your kids and your babies along as well. Yeah, if possible.
If possible. So, but your spouse can still accompany you for
yes,
these
of course, definitely. And even to the labor room, that's permitted.
One of the most common causes is ovulation problem. That's when the egg doesn't get released. Okay, you may have many eggs in the ovary, but it's not released. So
how do we know that, or how can women know that?
Oh yeah, so generally, if you have regular periods, then most of the time you are ovulating. However, if your periods are very irregular, they don't come every month, they may come every 2 months or 3 months, then probably you are not ovulating so frequently. Okay, so that's one. The other common cause is fallopian tube obstruction or blockage. So the fallopian tube is the transport pathway for the sperm to reach the egg. Okay, so there are 2 one on each side, on the left and the right. So generally they are not blocked. However, certain conditions can cause them to be blocked. For example, previous pelvic infection, previous operations,
or like cysts.
Or sometimes cysts or endometriosis. Endometriosis is a common cause. So if you have any of these conditions, or if you had previous...
Sorry, what's endometriosis?
Endometriosis is a condition where some of the, to put it simply, is when the menstrual blood backflows. Instead of coming out, some of it backflows into the pelvis. So over there...
it forms a clump.
Oh,
is it the chocolate cyst?
Yes.
Okay.
So that's so it's chocolate cyst, so you know.
Okay,
so
sorry.
It collects in the tummy and then it forms endometriosis. It usually causes very painful periods now.
Right. But so does it mean that if you have a chocolate cyst or endometriosis that you need to go for treatment and get it out?
Well, definitely if you have endometriosis, you should get it treated. But it's not so straightforward that with a cyst, definitely you need surgery. So it depends on a lot of factors like how big is the cyst, and then what is the location? Is it one side or both sides? Because treatment sometimes has its own problems as well in terms of surgery. Okay, so you have to see a doctor. If you have an endometriotic cyst, the doctor will discuss with you the pros and cons of surgery. Okay, so these are another major cause is that of reduced ovarian reserve or reduced egg count in the ovary. So every woman is born with a certain number of eggs, and every month they will lose some eggs from ovulation. Okay, until menopause when they have no more eggs left.
Yeah.
So some patients have accelerated egg loss for whatever reason. For example, if they had ovarian cysts, or they had ovarian surgery, or they went for chemotherapy, for example.
Right.
Okay. Sometimes being exposed to toxins like smoking, excessive drinking can also reduce the egg count. Okay, so these are some of the major causes lah. And then nowadays, last time we always thought that fertility problems are mostly female. Nowadays, we realize that actually a lot of infertile couples have a male factor as well. So that is present that's how we tell is the sperm count is low. Okay. You can suspect that by if you had a history of any testicular surgery, or you had undescended testes when you were young, the testis was in your tummy and it didn't go down. All these are causes. So,
but there's a surgery for that, right?
Oh yes, sir. Yes.
So if you had that surgery, does that then affect your chances, or?
It's hard to say.
Right.
Sometimes with the surgery, it can actually improve your sperm count or make it almost normal. Okay. sometimes despite the surgery, the sperm count can be very low or even nil. Okay, but a lot of these conditions are actually silent. So even though you don't have any symptoms, you have regular periods, you have no pain, you know, you're a very healthy adult male, you have no medical problems, you can still have any of these fertility problems if you don't check. Okay. I think so. I think a lot of the couples that are in the fertility clinic are very, very stressed, but it's really not within their control. It's something that you cannot really prepare for. It's not like you can study very hard for O-levels, for example. But this one is like, sometimes the more you think about it, the more stressed you are, and then the more it doesn't come, right? Okay, so how does it affect? So, so sometimes when you're very stressed, the periods can actually go from regular to irregular. For example, when you have a major project coming up or you're studying for exam, then suddenly you find that your menses doesn't come on time. So that's one, it affects your ovulation. And then also affects sexual performance. So especially there's a fertile window, there's a concept of a fertile window. So you're expected to have sex at that time. And if you miss it, then you have to wait another month, you know? So sometimes that...
I feel that stress. That stress is very real.
Yeah, so that takes the passion out of it. And you feel that a lot of guys have this problem when they don't have this stress of having to have sex, then they can have sex quite naturally. But once it comes to that specific night, then they have problems doing it. So it's actually quite common nowadays. So the answer to that naturally would be to try not to be so stressed and exercise. So if you do exercise, healthy diet, your testosterone will naturally increase. That's your male hormone. And then it will increase your libido, your sex drive, and your sexual performance as well.
What is secondary infertility? What causes it?
Oh, secondary infertility is when you already have a child, you got pregnant and you have a child already, and then after that you find it very difficult to have one more. Okay, so there's no one cause for secondary infertility. There's usually a multitude of causes. So one of the common cause is sometimes after childbirth, the woman's BMI will go up higher, and then that may cause some problems, such as it tends to cause the menses to become irregular, and it may affect ovulation. And as the BMI goes higher, the fertility is affected as well. It will drop. Yeah. So that's one of the main causes. Otherwise, we have to assess everything again to see what is the cause of secondary infertility.
Right.
But generally,
no, you go.
Yeah. Generally, as if a couple manage to get pregnant and deliver once, that's a very good indication that they can probably get pregnant and deliver another healthy baby again.
Right.
Patients with intense period cramps, they may be having conditions such as ovarian cysts or endometriosis or growth in the womb, such as growth in the uterus, such as fibroids or adenomyosis. So it's best to get it checked. Okay, so all these will contribute to infertility. Low sperm count is really a problem. So unfortunately for the men to improve the sperm count, there are not so many treatment available. Okay, because a lot of times it's not understood why there is low sperm count. But to help with low sperm count, there are a variety of reproductive techniques or treatments such as IUI or IVF. In fact, IVF is very successful for treating low sperm counts.
I think for both men and women, there is a decline in fertility with age, more so for women than men. So I probably would encourage women who are a bit older to seek fertility advice a little bit earlier. But in general, if you're on the younger side, less than 35 years old, you can probably try for about a year before you start to seek a consult. Unless you think that you might have a problem that is affecting your fertility, like say fibroids or endometriosis, like what Dr. Chua has mentioned. So we can assess fertility treatments in most hospitals in Singapore, but the public hospitals that offer fertility consults and treatment would be SGH, KK, as well as NUH. For IVF, usually what we'll do is that we'll give the woman hormones. The hormones are exactly what you produce in your natural cycle. So in your natural cycle, at the start of your natural cycle, your brain produces signaling hormones that tell the ovaries to make mature eggs. So the hormones that we give you for IVF are exactly the same. So usually for most women, we'll give either a 2-week or 4-week course of hormones to tell the ovaries to make mature eggs. And during that time, the woman would probably have to come into the center to be scanned or do some blood tests, probably about 4 to 5 times. Okay. And when we think that, the eggs are good to collect, usually what we'll do is that we'll do a procedure to collect the eggs or an egg retrieval. So this is not surgery. Usually the procedure is done entirely vaginally. You can go home on the same day. In SGH, usually we'll give the woman some light sedation, and for most women, it's quite a pain-free kind of procedure. All right. So after the eggs are collected on the same day, usually we'll get the husband to produce a fresh sperm sample, and then we'll do the fertilization. So the eggs and the sperm meet in the laboratory, and after that, the embryos are put back into the uterus or in the woman's womb for a couple of days after that. So the embryo, what we call, the procedure is called an embryo transfer, and it's also something similar to what a woman goes through during a pap smear. So I think the usual advice would be for guys, for both men and women, smoking is bad for fertility. So I will encourage, you to quit smoking or at least cut down on smoking if you are embarking on trying to get pregnant. Probably, I think it wouldn't be helpful to stop smoking, like say 2 weeks before you start IVF, because for most men, okay, they do take about 2.5 months to make sperm. So whatever you do within 2 weeks wouldn't make an impact on your sperm at all. So you need to quit smoking at least 3 months before you start IVF or IUI. The other thing that I would encourage couples to do would be to optimize their weight. So this is especially so for the woman, because the fertility medications, okay, are absorbed by the fat. So the higher your body fat, the more of these fertility medications will reach your fat, where we don't want the effects to be. We want the fertility medications to go straight to your ovaries to have an effect on the ovaries. So probably before embarking on IVF or while waiting to do IVF, I think it might be good to reduce a bit of your body weight or try to optimize your body weight before you start IVF. And if you do get pregnant with IVF, optimizing your weight can also help to reduce risk during pregnancy. So I think the usual advice will also be I will usually encourage my couples to eat well and also reduce stress before embarking on IVF. So probably, I think a diet that is rich in antioxidants, fruits and vegetables, okay, might be good to promote eggs and sperm quality. And I think the other thing I would advise is, it doesn't mean that if you're going to start IVF, you won't be able to conceive naturally. I think it's still important to, keep trying. And who knows, you might end up getting pregnant naturally, the month before you start IVF, for example. So the success rates do go down with the woman's age. So I think if you are closer to 30 than 40, probably the chance of getting pregnant per IVF cycle would be about 40 and maybe even 50%. Once you reach the age of 35, you'll probably have a 30% chance of getting pregnant, and closer to 40, the chances of success would be about 10 to 20%. For IUI, it's also a similar story. So the older you are, the chances of getting pregnant do go down. So closer to 30 years old, you have a 15% chance of getting pregnant through one IUI cycle. And 35, it will be about 10%, and closer to 40, it will be probably about 5% per cycle. So I think in general, I'll tell my patients that the success rates for 3 cycles of IUI would equate to about 1 cycle of IVF. So I think IVF, although it's more expensive, it's more invasive, it does involve more medications, it's probably more efficient for getting pregnant than compared to IUI. IUI is much cheaper compared to IVF. the cost of IUI can range from about $1,000 to up to $2,500, depending on what medications we use. The cost of IVF is about $12,000 to $16,000 per cycle.
Wow.
So in Singapore, if you are a Singaporean, or if one of the couple is a Singaporean citizen, and the woman is less than 40 years old, they do get, the government does give you co-funding for both IUI and IVF. So the government gives co-funding for up to 6 cycles, 3 fresh as well as 3 frozen IVF cycles of up to $7,700 per couple. And this is on top of the MediSave that you can pay for IVF. So for IUI, the government gives you additional funding as well. And this can be up to about $1,000 per cycle. But I think what many people don't realize is that there are studies that show that most pregnancies are conceived if the couple has sex within the 5 days before ovulation. So for example, if you have a regular 28-day cycle, you're probably ovulating on day 14. And you probably should start having sex probably about day 8 to 9 of the cycle in order to maximize the chances of pregnancy that cycle. SingHealth has also what we call a health buddy app that is quite convenient, not just for accessing information about your health, but also for making appointments, etc. So just to help you to navigate around this app, because it's probably a little bit tricky to use in terms of finding the information that you want. So if you like to find out more about fertility, pregnancy, or any gynecological condition, just go to Conditions and Treatment and click on the button at the bottom of the body and click on uterus, and you can then what pops up would be a whole list of conditions that you can get advice and further information about. So things about IVF, infertility, ovarian hyperstimulation, endometriosis, etc., as well as information about what to eat when you're pregnant, pregnancy diet, exercise during pregnancy, etc.
First of all, I think if you do have what we call that a term called dyspareunia, you have pain during sex intercourse, I think that you should get a check on the gynecologist, because it can be a few reasons. Of course, that if it's really a few factors you need to find out. If it's what we call superficial pain, it can be due to what we call a condition that you can't receive sexual intercourse, that's called vaginismus. And sometimes you have pelvic floor allodynia, that's actually because of the pain, the muscle tone and all that, of course. And the other thing is, earlier on, I think Dr. Chua mentioned, is actually endometriosis. It can be quite significant. And other things can be also due to previous pelvic inflammatory disease. So you do have pain during sexual intercourse, I think you should seek your help from a gynecologist and to find out what's the reason, and then to go on from there, yeah.
Majority of them are water-based, so they are composed of mainly water. So it's found to have maybe a detrimental effect, just like saliva. So it can make the sperm swim actually slower, reduce the motility. So oil-based lubricants are better. So there are some sold in the pharmacy, like for example, the brand is called Pre-Seed. So these are oil-based lubricants, which actually does not affect the motility. So if you are trying for a baby, then you may want to consider using some of these.
So for the men, the most basic test would be just to get a sperm test. For the women are more complex. So usually we advise the woman, in our center, usually we advise the woman to do a blood test or a scan to check the egg count. We also do advise a scan to check whether there are any structural problems in the womb or in the ovaries, like an ovarian cyst or a fibroid. And then usually we'll also recommend to do a tube test as well to see whether the tubes are blocked. So Clomid is a medication. It's a tablet that sends signals to the brain to increase the signaling to the ovaries to help you to ovulate.
Right.
Well, I think in general, it's not wrong to start to give the patient a trial of Clomid for a couple of months. But if you don't get pregnant after trying with Clomid, I think it's probably advisable for you to complete the fertility checkup. I think for couples who are a bit on the older side, or if you think that the man might have a problem with his sperm, it's probably better to get yourself checked early, so that if there are any problems that are identified, you can get them sorted out early rather than wasting time on trying Clomid without any success. So for example, if the tubes are blocked, taking Clomid won't help you to get pregnant because the sperm and the egg meet in the tube. So even if Clomid helps you to get your egg out, the sperm and the egg won't meet because your tubes are blocked. Or for example, if the man has poor sperm, it's very unlikely that, even with ovulation with Clomid, the sperm is unlikely to reach the egg easily. And you probably would have to try something like a fertility treatment on top of Clomid. I think nowadays, most IVF clinicians would probably do like a short cycle, that means of about 2 weeks of injections. But there are some patients that potentially need a long cycle, which is about 4 weeks of injections. So it really depends on your medical condition or your fertility factors. So previously in Singapore, there was an age restriction for IVF. So previously women above the age of 45 were not allowed to do IVF in Singapore. But from the start of this year, the government has lifted the age restriction such that you can potentially do IVF even at the age of 46 or 48 years old.
So teratospermia, you got it right. So it is actually the diagnosis of on the semen analysis, on the sperm test. So there is a parameter which says morphology. So teratospermia is a medical term for low morphology. Okay, so as I explained earlier that actually this is very, very common. We're not sure exactly why, but it does not seem to affect pregnancy. So a sperm test that comes back as teratospermia only, with only low morphology and nothing else abnormal, we classify it as essentially normal.
I think in general, as I mentioned, the chances of infertility does increase with age. I'm not saying that a woman above 40 or close to 40 is unable to get pregnant, but probably the chances are a bit lower, and I would suggest to get a fertility consult earlier if you're closer to 40. I think probably for most couples on the younger side, after trying for 1 year and not succeeding would probably warrant a fertility consult. Yeah. And if you're older, you'll probably want to seek a doctor's advice a bit earlier.
I mean, I would agree with that. I think the most important factor that will affect one's chance of fertility is always usually the age of the couple. So the younger you are, the more fertile you are, obviously, because we're all made to have kids when we're younger. Our parents had kids when they were 20-something. Now we are delaying pregnancy to the age of, late 30s or 40s. So of course that would affect your fertility. I think certainly if as a couple, you feel that you're actually ready to embark in a pregnancy together and you're in your mid-30s, I would say it's actually not wrong to seek a gynae's opinion, not only for fertility checkup, but also optimization of your health in general, which is not only important for conception, but important for the actual pregnancy itself. I mean, a lot of my patients just think, I just want to get pregnant, right? But they do not think about, after they've gotten pregnant, whether their medical conditions would affect the actual pregnancy itself.
Yep.
And whether their medical conditions will affect the delivery and also affect their, children in the future and all that. So I think take this opportunity, to adopt a healthy lifestyle, exercise, have a great diet, and not only that, we talk about diet, exercise all the time, but the other thing that's very important is also the emotional well-being and the mental well-being of the couple, because getting pregnant is actually very stressful. So I always tell...
Trying to get pregnant is also quite stressful.
Trying to get pregnant is stressful. Being pregnant itself is stressful. After you deliver, it's also stressful, right?
Life is just...
I think it's just very stressful. So I just tell my patients most of the time is, if they're young and, we've ruled out any other reasons why they have difficulty falling pregnant, just tell them to go and have regular sex and don't stress out about, ovulation kits, I think there was one question that Dr. Chua answered earlier on about, ovulation kit is negative. Does that mean I'm not ovulating? Ovulation kit is positive. So that's why I personally do not get my patients to do ovulation kits, because I think it just adds on to their stress. So just have regular sex.